Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so glad you could join us today. Thank you very much for being here. In this third segment today, I'd like to talk about the natural neck lift. In the office, I've received so many phone calls and inquiries about this procedure that I'd like to take a few minutes to explain this to you. First of all, the natural neck lift is more than just a single operation or a procedure. It's actually a system whereby one's neck and jawline and the structures surrounding that area are analyzed, and then every person gets a custom designed approach to neck rejuvenation. And that's what we call the natural neck lift. I think that whether you're a man or a woman, to have a crisp, clean neckline and jawline is highly desirable. And I think in many ways, people will focus on the appearance of one's neck. And when you're looking at someone or talking to someone, I think the appearance of the neck can almost play as much of an important role as the face or the eyes. And it's one of my favorite areas in plastic surgery. And fortunately, most people are very delighted with the results of a natural neck lift. So let's talk about more specifically what the natural neck lift or the system of analysis and improvement is all about. As I said, the crisp, smooth neckline or strong jawline is important to both men and women. And when I see someone in the office, I start with looking in the mirror, or I start with having them look in the mirror as I am looking with them, and I have them point out what they might want to affect. And in my eye and in my mind, there are 4 components that I specifically zero in on. Number 1 is the skin. Number 2 is the fatty layer. Number 3 is the muscle. And number 3 is the underlying structure. That's oftentimes the bone, the mandible, and the deeper structures beneath the superficial muscle. Let's start with the skin. Again, the skin has more than one component. I look at the texture of the skin. I look at the sun damage. I look at the presence or absence of lines or crepey, the sort of crepey complexion that sometimes will develop in the neck, oftentimes after sun exposure. And after studying the texture of the skin, I will look at the volume of the skin or the resilience of the skin. And each of these qualities of the skin can be addressed differently. For example, the texture of the skin can be treated with skin care. Sometimes a very light or superficial peel or laser can address the texture, but that doesn't address the volume of the skin. So first, as I said, I look at the texture. We can also look at the color changes. Some people have pigment changes. Some people call these age spots or liver spots. And those can be effectively treated to improve the appearance and texture of the skin of the neck. Number 2, the amount or volume of the skin and the resilience of the skin. I would say in general, for people who are younger than, say, 50 or 60, they have quite a bit of resilience to their skin. Now, what that means is that as I affect the structures underneath the skin will accommodate to take on the new outline or the new silhouette of what's affected. For example, if a person has a lot of skin resilience and I remove a fair amount of fat from the neck, that resilience of the skin will allow the skin to redrape and recontour and present a very pleasant or much improved, pleasing silhouette. If a person is lacking resilience, and in general, a person gets to be over age 50 or 60 and they start to lose resilience of the tissue of the skin. So if I remove lots of fat from underneath the skin, that may leave draping skin or hanging skin or loose skin, and thereby resulting in an incomplete correction. So when I find myself in that situation, or when I find that a patient is in that situation, I will oftentimes recommend a skin redraping procedure, such as a neck lift, whereby I make an incision underneath the chin, sometimes around the ear, sometimes in back of the ears, and that way I can redrape the skin, and also that allows me to get access to deeper structures such as the muscle. So again, the first component that I look at and analyze when I'm considering a natural neck lift is the skin. And as I said, there are 2 different components to the skin. The texture, which is what we can see and feel. Are there age spots? Are there liver spots? Is there sun damage? Is there a crepey complexion? Are there fine lines and wrinkles? And secondly, I look at the resilience and volume and amount of skin and decide together with the patient if a redraping or tightening procedure of the skin of the neck is indicated. That's number one. Number two, I look at the amount and quality of the fat below the skin, and I look where it's distributed. Almost everywhere in the body, underneath the skin is a fatty layer. And that fatty layer is between the muscles and the skin, of course. That's called the subcutaneous fat. It's ubiquitous. In other words, found almost all throughout the body. There's the skin on top of a fatty layer, and there may be a superficial fascia, what we call a fascia. Fascia is like a supporting collagen structure. At times it can be very tough. At times it's very thin. It can almost be like a piece of leather. It covers muscle, and it's a structural support system. So again, there's the skin. Underneath the skin is the fatty layer, and that lays upon the muscle. So I look at the volume of the fat, I look at the type of fat, and I look at its distribution. There are different ways that we can sculpt and remove, and on rare occasion add little bits of fat to certain areas of the skin. So one of the ways I remove fat from the neck is by liposuction. Liposuction is a procedure whereby a very small incision is made for the neck, oftentimes under the chin, maybe one or two small incisions, and an incision near each earlobe, which allows me to pass a cannula. A cannula is a kind of tube. I connect the tube to a vacuum, and I can vacuum out the fat. And that's very reliable. It works very well, and lots of fat can be vacuumed out. And I typically, for the neck, use very fine cannulas. I call this, it's a variation of a micro-liposculpture or micro-liposuction, whereby I can really sculpt and tailor and trim the fat to the contour that I would like to see. Now, so that's one way, liposuction. That's great for people with good skin resilience, and it's great for a person that I feel I can affect the silhouette in the deeper tissues, and I know the skin of the neck will redrape and recontour to the new shape. Another way that I can sculpt or tailor or remove fat from the neck is called a lipectomy, oftentimes a direct lipectomy. That's where a longer incision is made, either under the chin or behind the ear, sometimes in front of the ear, and that allows me access to get it into the neck, into the fatty layer, and I actually can sculpt that. Sometimes I use scissors, sometimes I use sort of a variation of a laser, an electrocautery, where I can melt and sculpt and mold the fat, and that way I can look at it and feel at it, I can look at it and feel it, and take another, I can redrape the skin, and I can just go step by step to layer and sculpt and tailor and almost mold that fatty layer that is between the skin and the muscles. Now again, so I talked about suctioning, that's liposuction, and most people are familiar with that. And I talked about a direct lipectomy, which is going through a larger incision to sculpt and mold and tailor, and sometimes visually or under direct visualization to melt the fat, and so I can examine it layer by layer and step by step. And that can be very effective during a natural neck lift. Now, step 3, I look at the muscle. Now, it's very interesting that sometimes people will come in or they'll schedule an appointment and they'll put on the appointment they're concerned about their turkey neck, or they're concerned about the waddle under the chin or their neck, and they think it's just extra skin. Well, it's very important to realize that the muscles in the neck can get loose with time. In particular, there's a muscle called the platysma. The platysma is a fan-shaped muscle. It's very broad, and there's one on each side of the neck. And in some people, it meets right in the middle, and in some people, the bands of the platysma are a little bit separated. So commonly, when that platysma muscle gets loose or lax or redundant, people can get the sort of turkey neck appearance or that redundant tissue or kind of a waddle under the neck. And if I address the skin and fat alone, and I don't address that platysma muscle, then again there will be an incomplete reconstruction, an incomplete rejuvenation, an incomplete change in the appearance during the natural neck lift. So again, step 3 is to look at the muscle. Sometimes what I will do is redrape the muscle. I can tighten the muscle through a relatively small incision under the chin. Oftentimes through incisions near the ears, I can slip in and redrape and resuspend the muscle and tighten it, and that can be very effective. As an aside, one of my favorite courses in pre-med was comparative anatomy. It was interesting to me that in our species, in men and women, the platysma is what we call a vestigial muscle. In other words, it's atrophied to the point where it hardly has any function except to give the plastic surgeon work. In people, the platysma muscle extends from about the level of the jaw to the clavicles. In the horse, the platysma muscle allows the horse to shiver. So in the horse, the platysma muscle starts at that huge jaw or mandible of the horse and continues over halfway down the body, certainly beyond the clavicles, and that's the muscle that shakes to allow the horse to kind of shiver and get the flies off it. It was always fascinating to me that that same muscle, of course, is found in other mammals, and in our species, as I said, it has it's reduced to the size where its only function that I know is to give the plastic surgeon work. Now, finally, the fourth category, or the fourth aspect that I study and look at when someone is considering neck rejuvenation, is the jaw and the chin itself. Now, on rare occasion, especially when the teeth are malaligned or misaligned, I can work with the oral surgeon to actually bring the jaw forward or backward. When people have a malocclusion, we can work to correct that dental alignment. And as I said, I work with the oral surgeons to bring about that effect. And not only can a person look better, but their alignment will be better and their dental function will be better. Now, what about the chin? There are a couple of ways that I can affect the chin. Oftentimes a person, whether it's a man or a woman, if they're desiring a stronger, crisper, cleaner neck line and a look to their chin, I'll recommend a genioplasty. Now, there's two ways that we do that. We can oftentimes affect the position of the actual chin, the actual bone, and I do that by advancing the bone of the chin. We can do a special type of division of the bone called an osteotomy, and then I can rigidly put it back in place, typically forward, and then I can rigidly hold it there with plates and screws, and that's all done through the mouth, on the inside. That's called a bony advancement genioplasty. At other times, I will do a chin implant, and sometimes what we do is to place a silicone elastomer by making an incision either under the chin or through the mouth, and that will allow me to gain access to the chin itself, and that way a silicone elastomer will be placed there. And there's pros and cons to each decision, whether or not a patient has a bony genioplasty or whether or not they undergo a chin implant. It's really a personal decision, partly made by me. I can make a recommendation, but ultimately up to the patient. And oftentimes we'll do a genioplasty for a person who is also having other facial surgery, such as a rhinoplasty or nose job. What we aim for in plastic surgery is to have balance and symmetry and harmony. And oftentimes the chin and the jawline and the neck itself will play a very vital role in the overall appearance of someone's face. I find that many patients will come into the office thinking that they want a facelift, but when I put the mirror in front of them and they point to what they really want to affect, it's mostly a neck lift. And I find particularly in men, in the male patient, they'll oftentimes do much better with a neck lift than they will do a facelift. I find that oftentimes a facelift on a man may give an unnatural appearance, but almost consistently across the board, a neck lift or a natural neck lift will result in a much improved appearance for both men and for women. And I think that's one of the reasons why there's been a lot of demand for what I call the natural neck lift. And of course, None of these procedures that I've talked about bring about perfection, but we aim for improvement. I think that's very important to keep in mind, that we can't make anything perfect. But I think by systematically working with the patient and doing a preoperative analysis, I think that we can bring about a positive change in someone's appearance, particularly bringing about the natural neck lift. And thank you so much for being here today. I'd like to remind you, if you have a comment or a question, or a certain guest that you'd like to appear, or you'd like to hear us talk about something, please go to drmorwood.com. That's Dr. D-R-M-O-R-W-O-O-D, D-R-M-O-R-W-O-O-D, drmorwood.com, and we'd be happy to get your comments and your feedback. Thank you so much for joining us today. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. Thank you for being here, and please come again.